Hi, I'm Lazatin Mangaliman.
Hi, I'm Micah Mangaliman.
Hi, I am Jose Javier Lazatin.
Hi, my name is John David Sloat.
Have you ever wondered how ironic it is that despite healthcare's meaning to serve a fundamental purpose to provide cure, many people, especially Filipinos, are not provided with that cure? There are large geographic disparities in the Philippines, whereas in the urban areas there are excelling public healthcare facilities, but we can't say the same thing in rural areas. According to the Department of Health, this explains why 50% of Filipinos lack the basic access to basic healthcare facilities because of a 30-minute drive for patients. Another thing is poverty has prevented millions of Filipinos from getting the healthcare services they need. In short, there are Filipinos that are too poor to go to the hospital and get the treatment they urgently need. Aside from eternal scenarios or factors, an eternal factor would be how there are lack of hospitals, surgical equipments, broken down medical equipments too. These are the primary barriers to the quality in the healthcare Philippines. Since half the people who live in the Philippines reside in the rural areas, there are sometimes no licensed doctors, assisting nurses, and even their technology is outdated. That is to say, the quality of care in the medical system can be improved by emphasizing on the aspects of helping those in the low-income households affected by healthcare costs, ensuring accessibility to populated and rural regions, and enhancing the quality of healthcare services. So, why do we choose to advocate accessible and affordable healthcare for everyone? Let's discuss the following variables and data gathered. First is because it gives assistance to those in need, focusing on the vulnerable and low-income families. Since around 60% of the incomes of the poorest Filipino families is spent on food, simply they're preventing themselves from getting sick or any form of exposure to inevitable diseases because the money they have won't be enough to pay for their health bills. Additionally, being poor in their health is a significant contributor to poverty too. This is due to the cost of receiving healthcare, including transportation expenses and unofficial payments, so that they can have debts or loans. Since very poor people and vulnerable people have to make harsh choices. Like they say, prevention is better than cure. Fellow Filipino citizens have to make sacrifices over the other when many people are privileged to have both food and healthcare. An individual shouldn't have to lose anything just to get treated. Hence, lessening the impact of being uninsured can be improved by the government initiatives. This can be eliminated as a barrier to healthcare coverage by assisting uninsured people through a variety of policies and programs to reduce inequalities in status. After all, why should the cost of life be only favored to some? Aren't we all together living?
Second, this provides accessibility to densely populated and rural areas in order to ensure an equitable healthcare system that provides care for everyone. This is primarily attributed to the lack of an unequal distribution of health facilities across many regions of the nation. Around 50% of the populace lack quick access to primary care facilities. People living in rural areas where public transportation and internet services might be limited may be need to travel far distance to receive care. Indigents frequently live far from medical facilities and must travel long distance to access care. The National Capital Region or the richest region has the shortest travel time, which is 28 minutes, while the poorest region has the longest, which is 61 minutes. As to be expected, people traveling in rural areas take longer on average than those traveling in urban areas. To sum it up, inadequate public transportation makes it difficult for patients with mobility issues to access care. This should alert the government to carefully consider where to build healthcare facilities in order to support the goals of healthcare system and to build enduring and trusting relationship with the people and the communities they serve. The third one, people are discouraged from seeking healthcare when it is necessary. It is necessary because poor quality services lead to wasteful, expensive, and dangerous actions. Poor quality care erodes trust, puts patients at risk, and is completely unsustainable. Between 5.7 and 8.4 million people are thought to pass away each year in low and middle income nations as a result of poor medical care. In other words, in many nations, a person has higher risk of dying from receiving low quality care from services of no healthcare at all. There aren't enough healthcare professionals in the nation. This means people have to travel away from their home community to get medical care as provincial hospitals have limited access to medical supplies. Healthcare systems should concentrate on quality improvement by taking a methodological approach that will enable them to significantly alter a medical institution.
Javier Lazatin, and I will be talking about our topic's counter-arguments. Although we aim to promote healthcare for everyone, we will be needing the help and participation of the citizens, for accessible and affordable healthcare is not that easy. These arguments that I am about to state may counterattack what we stand for. First, universal healthcare means that each citizen has to pay the same amount for medical care regardless of their actual health condition. This will not be that beneficial for healthy citizens. In one proposal for universal healthcare, its option was a 7.5% payroll tax plus 4% income tax increase, leading to higher income citizens subjected to higher taxes. An increase on tax results to the people having less money to spend on their daily lives. The second counter-argument focuses on the government's budget. The universal healthcare would consume a significant portion of the government's budget. DOH Secretary Maria Rosario Vergire stated in a presentation that the department's budget has increased from only 268.4 billion pesos in the year 2022 to 296.3 billion pesos in the upcoming year 2023. The PhilHealth has also increased their budget from 79.9 billion pesos to 100.23 billion pesos.
And here's our conclusion. Through concentrating on the problems in healthcare, we can reduce the high out-of-pocket expenses for those in need, take into account the accessibility of citizens from both populated areas and rural areas, and improve healthcare quality for appropriate care and treatment. We came to the conclusion that healthcare should be widely accessible to everyone. Healthcare costs should be reduced because the main reason why Filipinos die young is because they refuse to seek professional help for their health issues, because they accept the poor quality of care, which may require them to travel great distances to access. Greater use of healthcare facilities due to lower costs and shorter distance travels will only lead to better health outcomes if quality of care is guaranteed. Let healthcare fulfill its promise to everyone, everywhere. They need it. At any time, they will need it, without exceptions or breaks. Improvement in healthcare should be visible and done. We need to make it simpler for healthcare services to be accessible and reasonably priced for everyone without exceptions or delays. Do you have any interest in paying a small price to let a citizen live longer? You do.